Hi everyone. Our topic for mini project is Ascaris Lumbricoides. We are from group 3, which is consists of Auni, KIRTHIKA, OMAR and TALISHAH. We'll start with the taxonomy of Ascaris Lumbricoides. It is a genus from roundworm under phylum of Mawaddah. They are typically small intestinal parasite. It is common species affects human is the Ascaris Lumbricoides. These nematodes are unsegmented, bilaterally symmetrical, unisexual and have pseudocolumn. The morphology of Ascaris is very large. The adult female is between 20 to 35 cm. The adult male is between 15 to 30 cm. The life cycle of Ascaris lumbricoides start with the ingestion of Ascaris egg from feces. The egg hatch in the intestine and migrate to lung via blood. The larvae then breed into alveoli and travel up trachea where they are cough and swallow. Lastly, larvae pass through stomach in intestine for second time where they become adult. The disease that caused by this parasite is ascariasis. It is asymptomatic, which causing only malnutrition and growth retardation. It may present with abdominal pain, nausea, vomiting, bloating, and diarrhea. It is caused by ingesting those worm eggs that can happen when hands or fingers that have contaminated dirt on them are put in the mouth. The host for this parasite is human and swine.
I'm going to talk about the epidemiology. So, ascariasis is found where access to personal hygiene and proper sanitation practices are not available in places where human feces is used as fertilizer. Ascariasis is widespread in tropical, subtropical regions of Asia, sub-Saharan Africa, and the Americas, with over 1 billion people estimated to be infected globally, as you can see in the figure below. As for the parthenogenesis, so there are two phases. So pancreatic larva, the migrating larva causes pathological lesions. The severity of lesion depends upon the sensitivity of host, nutritional status of host, number of migrating larva. During migration, molding through lungs, larva may cause pneumonia with low-grade fever, cough, other allergic symptoms. Phase 2, adult worm produce trauma in tissue, and wandering adults may block the appendical lumen, common bile duct, and even small intestine. In children, the infection is more common, which results in dull mental capacity, malnutrition, stunt growth. Metabolism of living dead worm are toxic immunogenic. For the signs and symptoms, the first is that the live worm will be seen in vomit and poop. If larva is traveled to lungs, we can be pneumonia and reaches to intestine, it's severe abdominal pain, and in severe case, you'll have a inflamed pancreas.
For specimen collection and processing, there are three major steps such as sample collection, preserving the sample, and also sample processing. After the sample is collected, it will be fixed in a fixative solution like formalin. The fixed sample will then be processed using a technique called formalin ethyl acetate sedimentation technique.
For the advanced diagnostic techniques, there are mainly four prospective techniques that can be used in place of the current gold standard, which is the CATO-CATS. There's FLOTEC, TF test, BM or Bayer-Mores, or HPJ, Hoffman-Pons-Jenner. FLOTEC or mini FLOTEC is a promising technique for high helminth diagnosis. It is usually better or equivalent in terms of sensitivity compared with many other tests. And although it's slow in processing and examining time, it is usually able to be used for quick and easy identification. For TF tests or 3 fecal tests, fecal samples are collected on 3 occasions on alternate days. And the advantage is that it produces low debris during slide preparation and has a high concentration of helminth and protozoa. However, it can be time consuming. For the BM test, it mainly detects nematode larvae, and its principle is based on thermotropism and hydrotropism. It uses simple equipments like warm water and the container, and it detects the larvae's movement or motility towards a suitable area for its growth. For this reason, it can be quite time consuming, and it also has limited sensitivity. And in the HPJ test, it is based on spontaneous fecal sedimentation, and it's mainly used for detection of helminth eggs, larvae, and protozoan cysts. Although it is quick in its examination, it requires some expertise to analyze the species. So in comparison with the gold standard, which is CATO-CATS, the most promising one is the mini FLOTEC test, which has shown results to be even better or equal in terms of its performance, its sensitivity in differentiating different species of parasites, especially for Ascaris lumbricoides. And these are the procedures being done.
As for the treatment of ascariasis, it is usually treated through the medication called anthelmintics, which means anti-worms. Albendazole, ivermectin, mebendazole are some of the examples of medication which are the anthelmintics. Finally, Ascaris lumbricoides is the most common parasitic worm. It causes ascariasis that has no symptoms. It can steal nutrition from its host, leading to malnutrition. We can prevent the spread of this parasite by improving sanitation and also hygiene practices. Thank you.